Hello again, and welcome to Life, Laughter, and Legacy with Roger Young. Now, in today's video, I want to talk about my experience with open heart surgery. About 30 years ago, I was diagnosed with having a heart murmur. Now, they didn't share with me which valve was leaking or the extent to which that the murmur was happening, but they just checked it, and they always asked me, are you out of breath? Are you having any shortness of breath? Are you getting tired? How's your stamina? Now, as far as I knew, everything was good. I mean, I mowed the lawn, I rode my bike, I walked. Now, I was, and still am to a degree, overweight. And there were times in which I lost weight, then I put it back on, and so on and so forth. And not until recently have I discovered the best way to eat and have a lifestyle to where I could lose weight and keep it off. And I'll tell you about that in a minute. But I had this heart murmur. And then and I was living in California for most of my adult life up until the summer of 2020. And then we moved from Santa Clara to California to Boonville, Mississippi. And that's a whole other story as to why we moved here and so on, but we are very glad we did. And we've got good friends here and loved ones in the area and so on. But nonetheless, getting back to the point, I noticed that once we moved to Mississippi, things started to change. Now, those two are not related, but I will tell you what I think made the difference. First of all, I got older. I continued to get older, and my stamina became more of an issue. And then last summer, well, actually before that, the week that we were loading up to move to Mississippi, I fell off of a car dolly. It's probably about 3 or 4 feet high. Had my car up on it, getting ready to tow it behind our U-Haul truck. But what happened was I slipped and I fell down, and I may have cracked some ribs. I had some pretty sharp pain in my side. I did not take the time to go to the doctor. I probably should have. But I felt that pain, and boy, I tell you, when I move certain ways, especially getting in and out of that U-Haul truck, boy, it was excruciating. But I figured I'll get by. I mean, we had people load the truck, and when we had a team of individuals unload the truck for us once we got to Boonville. So they did most of the work. But getting in and out of that U-Haul truck, wow, that hurt. And then a year later, and all the while I figured I was just adjusting to the climate, I found myself becoming more weary when I was mowing the lawn. And I was not doing any regular walks like I should have been. Over time, I should have been doing more regular exercises, but I wasn't. There were times, and I was sporadic when I did. But getting back to the point, a year ago, my wife and I were returning home after we picked up trash along the side of the road. We live in a somewhat rural area. And I was riding on my quad electric scooter. I took that for longer distances because of my knees hurting. And as we were returning home, a young man, about 18 years of age, without a license, without car insurance, came careening around the corner. He couldn't see me because of the sun in his eyes, and he swerved over to where I was on the side of the road, and he hit me from behind, and it knocked me out. I went flying over the handlebars onto the ground, and well, fortunately, when I went to the doctor that day, to the emergency room, they said, well, yes, you've had a concussion, but it does not appear you had a brain injury. They did a CT scan. So anyway, but that again, that and with having what I think now are cracked ribs for over the last couple of years, my stamina just was not good and getting worse. So finally I went to the doctor for a checkup, and he checked my heart, and he said, "How is it? Are you having shortness of breath?" I said, "I don't think my stamina is very good." And so sent me to the cardiologist, went there, they did a stress test, found an anomaly, and then I had an angiogram, and they checked out my heart. That's a catheterization into the heart, and they said, "Yep, you've got some issues." They said, "You're probably going to have triple heart bypass. And also, while you're having that done, we think it's time that you have your aortic valve replaced." And so I asked, "Okay, what does that entail?" They said, "We're going to put in a porcine valve." That's what is commonly called a pig valve. These valves are genetically treated porcine valves from pigs, but they're raised in sterile environments, and the valves are specially treated in such a way as to make them very appropriate for human use. Also, by having a porcine valve, I would not have to have blood thinner, and nor would I be facing problems with rejection. So that all sounded good to me. If I had a mechanical valve, that would increase the risk of a stroke or aneurysm, and I did not want to have that possibility increased in my life, since I'm close to 70 years of age. I'm actually 68. So in April 7th, 2022 of this year, and that's now 3 weeks and a week or so later, 3 months and a week or so later, I should say, I have progressed very well. Now, prior to the surgery, I went on the Mediterranean diet. That's fruits, vegetables. I have some turkey, I have some fish, but I eat very little meat, and I don't eat much compared to what I used to eat. In fact, since the surgery, I've lost an additional 20 pounds in addition to the 10 pounds I lost prior to the surgery. So now I'm moving at better 30 pounds lighter, and even more than that because I've lost a couple of more pounds. I'm losing now a rate about 2 pounds or so a month, and I feel terrific. My blood pressure is great. Everything's going well. Now let me speak to what it was like immediately after the surgery. I did not have to have, I guess I may be unique, maybe it's more common, I don't know. But other than Tylenol, I did not take any barbiturates or heavy-duty prescription medicine for pain. I did not need it. I didn't need any codeine or any of those other type of products. I don't use them, so I'm not familiar with what they're called. But I didn't really have any extreme pain. They got me up walking the first day. I was able to get out of bed. I swung my weight in such a way, my legs hanging over the bed. I did have assistance. I got up and walked a combined total of about 100 feet and returned back to the bed. They had me eating. They had me walking. I was weak. The surgery takes a lot out of you. So you're not going to get up and be running down the hall. Now, I am heavier than I should be, and I'm sure that makes a difference. But I got up and started walking. Now, since the surgery, let me tell you one thing the doctor said. He said after the surgery, he says, you need to increase your calorie intake. He says, I don't care, whatever you want to eat, get the calories in you, you're going to need them. However, other than what the hospital gave me to eat, they gave me soups, they gave me some chicken, just a regular hospital diet. Being pre-diabetic, they did not give me any sugary foods other than, I think it was some pudding. But anyway, I ate what they gave me, but I did not have much of an appetite, and did not have much of an appetite for at least the first month. And even now, I don't have a large appetite. And I think that's one contributing factor as to why I've lost 20 pounds since the surgery, and I'm continuing to lose. But the Mediterranean diet for me was the way to go. I have not added any salt to my food. I do not eat any sugary foods at all. I do have a cup of coffee with some creamer, but other than that, that's it. My wife bakes fish or chicken in olive oil, carefully drained. But man, do I like soup. I like vegetable soup. I like vegetarian soup, Progresso brands. I eat clam chowder. I like that. But I just stay away from all of the carbs and everything else. Now, I do eat, I'm sure I'm getting plenty of carbohydrates by having a banana a day. I eat an apple a day. I may have some peaches. But fruits and vegetables are my main source of diet. When it comes to bread, I only eat whole grain bread. I don't have it every day. I might have a couple slices a day at the most, but that's it. Also, when I do have peanut butter, and I haven't had any now for a couple of weeks, I make sure to eat low calorie, and everything is low sodium. I decided that I can get by without salt. You see, life is a gift, and I choose to live it as healthy as I can. I have a responsibility to this temple, which God calls my body, is the temple of the Holy Spirit. And I've decided I needed to walk in obedience to the Lord with taking care of my body. I go out walking every day. I've been walking every day since the surgery, unless the weather is so bad that I can't get out, and I may walk some in the house. But by and large, here in Mississippi, of course, it gets very hot, so I walk in the mornings. I walk at least a mile a day without stopping, and I'm trying to get that up to at least a couple of miles a day, and I think I can do that now. However, I got on my bike and rode too strenuously and started to hurt my knees, so that slowed me up. So I had to rest my knee a couple of days and use a cane, nurse that knee to get it back to where it's strong enough so that I can make sure that I walk without pain, and I'm doing that. So I'm walking about 1.5 miles or so at least a day. Now that's not accumulatively, that's just on my walk itself. So accumulatively, I'm sure I'm walking at least a couple of miles a day, if not more. After 2 months, I started mowing the lawn and went to church within a month after surgery. In addition to that, I will say I've had over the last year, I have had all inoculations, COVID inoculations. I had a tetanus shot after I got hit by a car. I had my tetanus shot, shingles shot, pneumonia shot, flu shot. So I feel like an inverted porcupine. I've had so many shots. Now, I want to say a couple other things, and that is, it is important to stay mentally healthy after you've had surgery. So see, folks, stay in contact with your family. Try to socialize. Depression is a side effect for many people of having this type of surgery. It is traumatic to the body, and it can affect you emotionally. However, I have not had any depression. I determined immediately after the surgery, even before the surgery, to be grateful to everyone and to God. So everyone that came in the room, I said, I'm thankful for you. I praise God for you. How you doing, Mr. Young? I said, I'm doing fine. I'm grateful to be alive. I called the doctor my hero. I called all of my support staff your angels of mercy. And I gave God praise for every one of them. And I let them hear me pray for them every day. They said I was one of the best patients they ever had. And I'm so thankful for them. Every one of them, at the North Mississippi Medical Center in Tupelo, Mississippi. That center is one of the best in the nation. It's within the top 15 of the nation for cardiac thoracic care, and I had one of the best doctors anyone could have. All of the team in the central Mississippi area is outstanding. So I will say also, that it's important to go to church and keep up your spiritual life. So all of that, I think you've got the drift of pretty much of how I'm doing. The doctors say I'm doing better than most people after having surgery. The scar has healed up well. I'm going to give you a glimpse. There's not much to see. Close your eyes if you think this is traumatic, but I will show you that other than a thin red scar, it's about 10 or 11 inches long. I did not have sutures. I had glue. The breastbone was put together with titanium and maybe some other type of glue, titanium wires. But I did not have sutures on the scar itself. What I had was a glue, and followed all of the doctor's recommendations and orders not to get that wet for the first 10 days. Other than sponge bath, don't take a hot shower and get that all wet and melt the glue. So I didn't. So I followed all doctor's recommendations. I have no pain, and I have not been on any pain medication again except for the first 3 days where I had Tylenol. But no, I've not needed anything else. So that's my story, and I'm sticking to it. Thank you for coming to where the crawdads are singing. You can hear it in the background here in the heart of Mississippi in the South. God bless you, and thank you for listening.